Hello, my dear MDS aspirants, Dr. Amit Lall once again this side. So let us continue with our discussion on how to select a branch which will make you rich, famous, and successful in the coming years. Why I have been using this phrase, all those who have heard the previous videos, can easily correlate with that. Anything and everything we are doing in life at each stage of life, our requirements are different. That is very clearly being explained by the Maslow's hierarchy of needs theory. No matter what stage of life you are, what background you are coming from, everyone wants to be successful, everyone wants to be rich or richer or richest, and everyone wants to be famous. So let us keep things very practical. Whatever decision we are going to take in selecting the branch for our MDS, whether government or private institution, sooner or later when we come out, we really want to have a lot of work so that we can start working in the direction of calling ourselves successful after MDS. So this is the series. Let us continue with that. Today the topic is very interesting. A lot of messages and calls have been coming in this regard. And the ugly truth which I am going to speak about is regarding oral and maxillofacial surgery. Not many people. I have heard a lot of videos. I had interacted with n number of you can say maxillofacial surgeons across the country on this. Yes, there are some hidden truths which I think you all deserve to know. So let us be very practical. When some BDS aspirant is preparing for MDS, most of you have a target of becoming oral maxillofacial surgeon. Many of the BDS graduates we are interacting with, they want to become a maxillofacial surgeon. Now the results of NEET MDS 2025 are over and you guys are like hoping or aiming to get a seat in OS. But the question still remains, what after oral surgery? What after the MDS? In MDS, you all know, you have seen our previous videos also, what is the scope of maxillofacial. You all know very well. I'm not going to discuss that part. But when you come out, then the story changes drastically. Okay, and that's the ugly truth. You need to listen very carefully and understand. There are two types of oral surgeons when they pass out, and both of them have a drastic contrast of lifestyle when it comes to working post MDS. One is the person who is desperately needing to work only on the big cases, like the cases which are very exclusive to a maxillofacial surgeon, like going for clefts, orthognathics, high cases of panfacial trauma, then many facial deformities, many things. There are a lot of things in oral maxillofacial, you know that. That person is interested only in operating the bigger surgeries. You can classify like there are surgeries which are majorly involving general anesthesia. So my dear friend, try look around yourself, try meet people around you and analyze how many of oral surgeons in the country are actually doing GA cases in their own setup. Okay, very few, hardly, like you can count on fingers. So for this kind of an approach, firstly when you pass out, you have to accept your college, whether it's a government or a private, will not let you do each and every procedure you are reading, you are noting down in your register as a maxillofacial surgeon. There will always be some loopholes, like some institutions have these kind of cases more, so the other part becomes a void and so on. Like everyone has their own set of cases coming up. So when you pass out, you are not well versed, very well confident in all the procedures. Let us accept this first. Secondly, you need to follow one track. If you are aiming for some higher surgeries only, you have to pursue SRship, or maybe you have to pursue some fellowships in India, not abroad. Your oral surgery is not at all recognized abroad in the developed countries, because most of the developed countries involve MBBS for this maxillofacial surgery post graduation. Okay, so you need to enter into that system, that chain of learning. Like some do fellowships in onco, some do in cleft, some do SR, like pass outs to SRships, gain more clinical hand, more free hand exposure that is required to become a good surgeon. Because at your age, when you are passing out, the surgical hierarchy doesn't still allow you to work on the very big cases. So you need to have 2, 3, 4 years of learning curve after passing out. And the point to be noted here is such big cases are always and always available at the institutional setup. Very rarely you will get to see such small cases coming to your clinic or some small hospital or nursing home. But yes, that is the sad part. Okay, the distinguishing part between a maxillofacial surgeon clinic and a general surgeon clinic is general surgeon clinic has got a great daily OPD involving general surgery cases. But if you are an oral surgeon and you start your own clinic thinking you will get big cases, my dear friend, you are mistaken. You will not get big cases in your clinic. You need to be associated with big hospitals. All those who are planning to do oral surgery and they have some backup, like in the family or friends, you have big hospitals already running, right? Then you can easily vouch for that. Once you come back after post graduation, you will be absorbed nicely. Okay, otherwise it's a challenge. Last resort is you get attached to any MDS institution like dental colleges, work there for some time so that you get variety of cases there. And this graph takes a lot of time. All those, like I told you, two categories of oral surgeons after passing out. One, looking and craving and dying only for the big cases. They take a lot of time to settle down. At least now, once you are 35 or 40, then the money starts pouring in because you are still in a struggling phase. This is one hard truth, hard fact, which very few people will tell you. I know many will disagree, but yes, all those who are disagreeing, please share your own story to contradict me at this stage. Okay, I'll be more than happy to get contradicted, but I know what is the reality. That's why I am speaking today, right? The second category of oral surgeon is when he or she passes out, the immediate aim is to find work, not to sit idle, not to wait for anything to happen miraculously. Simply start working whatever comes on the way. They start doing consultations for impactions, maybe multiple extractions also, doing small IMFs and all, fracture management, small apicectomy cases. These are the people who don't say no to work, whether it's small, very small, or maybe anything. Then yes, implants is a boon segment in oral maxillofacial. You can have a great learning post MDS or during MDS into implants, learn higher surgeries as well, like sinus lateral nerve repositioning, zygomatic implants, and whatnot is available as on today. Learn, like sharpen your skills, maybe get collaborated with a good prosthodontist or a periodontist for your prosthetic support. That is a must if you, because or as an oral surgeon you won't be capable of doing good prostho. Okay, and implant is all about putting a good prostho, crown or dentures. So either you learn or you get collaborated with it. So when you are of the second category, the person who is ready to do any small kind of work related to maxillofacial surgery, whether it's extraction, impaction, apicectomy, small fractures, implants, you don't get to sit idle for long. You start getting work, you start getting consultations, you can even plan your own clinic. And when you keep on doing the small work, definitely you get money, you get confidence, you start getting famous, you start getting a feeling of sense of security, and patients more and more start pouring in. You definitely get big cases as well. See, nobody can sit in his or her own clinic and wait for big case to come. That may take months actually. But if you are in a clinic or in a setup or in a multiple setups consultant where you can get attached to it, you are on a right track, I would say, to get settled up initially. Nobody is wrong. Like category 1 oral surgeon is not wrong because he or she feels he's made for some big surgeries. Yes, you are not wrong. But that takes a longer graph to settle down. This one will start getting you a lot of work. Money will pour in, things will start moving forward in like right direction, I would say, which will make you happy and more confident. And then as and when the big cases come, definitely you will jump onto that as well. It's like if you keep on working in the industry, you works, like you get more and more work. A person who is just sitting and waiting for the work to come usually gets lost in the crowd, right? So this is another aspect. So many oral surgeons who start their own practice, I won't name them, but I know them personally and they are doing great when they start their own clinic. They even have done RCTs, fillings, definitely extractions and other things in the beginning. Please don't take it as a degrading or downgrading or downsizing your qualification or education if suppose you have to do at a point some part of general industry. That is one thing, you please keep that ego aside if you want to settle fast in the profession. I'm talking about profession, not any branch per se, right? So keep that very simple. You don't have to do rest of your life RCT. Or the easiest is get married to a person who can handle the general dentistry part and you can practice exclusively. Or you hire somebody in your setup, but that doesn't generally work in longer run. Marriage definitely works, but not the consultant level approach. Is like you cannot call for RCT endodontist is coming, for crown prosthodontist is coming, for gums periodontist is coming. Your clinic will not turn out to be a great successful clinic in that regard. Okay, I hope you're getting that point. Okay, so there is nothing wrong in doing the general dentistry in the beginning if required. If you are already getting a lot of work, a lot of consultations, then definitely you don't require such things to happen. But yes, even if you have to do it for maybe 1 year, 2 year, 3 years, you don't have to do rest of your life. Okay, but that will keep the things rolling. If you keep on doing things, you will not have to sit idle and you will be more than happy and contented with the profession, the returns of the profession which are going to come immediately after it. Now coming to a very important part, there had been a question asked by me, asked to me many students who are about to take. They belong to tier 2, tier 3, tier 4 cities also. To be very frank, it's easy for settlement in tier 2, 3 and 4. If you belong to tier 2, 3, 4 city and you want to settle down there after MDS, then yes, oral maxillofacial surgeon is the right branch. People do respect a person who is having that skill of surgery. Like you are a surgeon. I know like one very senior doctor, Marwa, like we used work together in implant course in 2008. Okay. And he was like very senior, like his son was doing BDS or MDS that time and I was the youngest in that batch. Dr. Marwa used to say he was from Muzaffarnagar. He is from Muzaffarnagar and he used to say that in Muzaffarnagar he was one of the earliest dentists and he was famous as a surgeon, not as a dentist. Okay, because he was a maxillofacial. Like, so this is the respect you get to earn in small cities like tier 2, tier 3, tier 4 cities. So, but in tier 1 the situation changes. There is a lot of competition, lot of stiffness. You will have to struggle for 6 months to 1 year to start getting things rolling in your favor. That is applicable to any and every branch which is dependent on finding out consultations. Okay, so whether it's ortho, OS, maybe prosto consultations you are looking for. If you want to work exclusively in your branch in the tier 1 city, you can say a wait time of 6 months to 1 year or maybe a little more may happen. Okay, until unless you have a lot of contacts, you have already a sound backup of things rolling in your favor. So this is a lot of things I have discussed with you. So choose wisely. Nobody is judging you whichever track you follow. Okay, whether you want to pursue your dreams of doing only big surgeries, you are not wrong, but that will come little late settlement in life. If you are doing general dentistry after oral maxillofacial surgery, if you are doing small cases in multiple clinics, if you are doing only implants after being oral maxillofacial surgeon, trust you me, nobody is saying you are wrong. Don't listen to people. Okay, just follow the passion. If you want to do oral surgery, do it, but be ready to face the world in this 2 segments which will change your like coming years drastically. Like you cannot like have a very, you can say, distinguished career if you are not clear about why you are doing oral surgery and what you are going to do after that, right? Any more questions, please post in the comment section. I'll try to cover up in the next video. I decided to take these sessions like these small videos rather than taking live sessions because it saves time for both the sides, and definitely we will keep on interacting more and more on this. So any questions regarding the oral maxillofacial surgery settlement post MDS I'm talking about, please mention in the comment section. I'll be more than happy to address that. Thank you. Have a great day. All the best for your upcoming counsel.